Real news for Americans 50 plus. This is Emeritus News Channel.
Good afternoon, everyone. We are now in a period where the vaccine availability is increasing steadily, but far too slowly. It's frustrating to all of us. We wish there were more vaccine available. We need to remember that the enemy here is a virus. Pandemic influenza is very challenging to deal with. The tools that we have available are not as modern as we would like or as rapid, and all of us can be part of an effective response. Manufacturers are working hard to get as much vaccine out safely as possible. The vaccine strains of the virus grow, and that's how we develop vaccine. Even if you yell at them, they don't grow faster. And the government, we're doing everything we can to get vaccine out as soon as it becomes available. Shipping is overnight. We're distributing to literally tens of thousands of doctors, hospitals, health centers throughout the country. The healthcare providers can do quite a bit with vaccinating as soon as vaccine becomes available. There is now a significant amount of vaccine available, and I'll go through that more in a minute. And also ensuring prompt treatment of people with underlying conditions or severe illness. H1N1 influenza remains overwhelmingly susceptible to Tamiflu. So people who are severely ill or who have underlying conditions and who get sick can rapidly be treated. Community groups and schools can do a lot to reduce the risk both of spread and of disruption of learning and work. And the public can do a lot by staying home when you're sick, covering your cough and sneeze, and washing your hands often. Also, if you have an underlying condition or you're severely ill with flu, see your provider right away. And of course, as vaccine becomes available, get vaccinated. Now, in terms of the virus, where are we today? We continue to have widespread activity of H1N1 influenza. 46 states are reporting widespread activity. We've had, up till now, many millions of cases of pandemic influenza in the U.S., and the numbers continue to increase. This remains largely a young person's disease, but we're seeing it increasingly affect young adults as well as children. As happens with flu each year, it generally begins in kids, and then we see it later in young adults. We are still not seeing significant numbers of cases in the elderly, and that is a characteristic of this virus, which has not changed since spring. We're not seeing any greater severity of this particular virus than we did in the spring, and it's comparable generally to that of seasonal influenza. And again, we're not seeing significant increases in resistance, nor are we seeing big changes in the genetic nature of the virus that would make it less susceptible to vaccine. We're seeing an increasing number of schools closing because of the virus, and we would just remind school administrators and others of the CDC guidance that indicates that schools should be closed when administratively it becomes very difficult or impossible for the school to continue operating, or if there are a large number of kids who have serious underlying conditions such as muscular dystrophy that would put them at greater risk for serious complications of the flu. And of course, it is a local decision whether or not to close. We provide guidance, and we've worked closely with the Education Department on that. As of now, we have seen, since the beginning of the pandemic in April and May, we've seen more than 1,000 deaths from pandemic influenza and more than 20,000 hospitalizations in this country. We expect that influenza will occur in waves, and we can't predict how high, how far, or how long the wave will go, or when the next will come. We're now in the second wave of pandemic influenza, and whether this will continue through the fall into the winter, whether it will go away and come back in the winter in traditional flu season, which would peak usually in December, January, or February, only time will tell. Various estimates are possible, and we look carefully at that. What we're committed to doing, as we've been doing from day one, is to provide all of the information that's available to us, to you, as soon as we are confident in it. What we've learned more in the last couple of weeks is that not only is the virus unpredictable, but vaccine production is much less predictable than we would wish. We're nowhere near where we thought we'd be by now. We're not near where the vaccine manufacturers predicted we would be. And we share the frustration of people who have waited online or called a number or checked a website and haven't been able to find a place to get vaccinated. As public health professionals, vaccination is our strongest tool, and not having enough of it is enormously frustrating to all of us. The enemy, again, here is the virus, and the technology that we're using, although it's tried and true, is not well suited for pandemics. Our planning anticipated a 6 to 9 month period between emergence of a new virus and availability of vaccine against that virus. The 6-month clock will be up really at the end of October, and by that time we will have some vaccine, but not as much as we would like. As you recall, we had an ethical choice a few weeks ago where we had some vaccine available, and we knew that getting out some vaccine, not enough for everyone who wants it, would be a challenging situation and would be frustrating for many. The alternative would be to let it stock up until we have enough for a larger proportion of people who wanted to get it. Doing that would have meant that it would be waiting in warehouses when people who want to get vaccinated could get vaccinated and could be protected. As of this Wednesday, there were 14.1 million doses available to the states for ordering. 11.3 million had been shipped, so there are now more than 11 million doses in the community in various places. As of today, there are 16.1 million doses available for shipping, and if you look on a week-to-week basis, we had a big increase in the past week in the amount that had been shipped out to the community, an increase of about 5.4 million doses between last Wednesday and this Wednesday. So there is steady progress getting vaccine out. There is a lot of vaccine out there, and we've been working hard to ship it overnight, to work with states and localities so that they can hit the ground running, and to try to make it as easy as possible. One of the things that we're hearing anecdotally, a lot of the initial vaccine is in the form of the mist, of the nasal spray. This is a vaccine that is available in many places. It's only recommended for use in people who are healthy and between the ages of 2 and 49. It's available, both seasonal mist and H1N1 mist is available. This year I received seasonal flu vaccine a couple of weeks ago using the mist. There's every reason to believe it will be as effective as the shot. It's one less needle, so kids may like that. And there is no risk to healthcare workers if they get the mist for their patients. There are some misconceptions about this. It's a weakened virus that's been adapted in the laboratory not to grow at the usual human temperature, so it's something that is not a risk to your patients if you as a healthcare worker get this vaccine. On the flip side of the frustration is the fact that there's a lot of interest in this vaccine, and we're glad to see that. We wish it didn't take so long to produce, and there have been efforts going back many years to develop more rapid methods of producing vaccine. More than $2 billion has been spent by the Department of Health and Human Services trying to develop newer methods of vaccine production. This is a high priority, but it's not easy, and we will not go out with a new vaccine until we're completely confident of its safety. So even if we had a new vaccine now, I'm not sure we would use it in the midst of a pandemic which has a similar level of severity to seasonal flu. In the coming weeks, we will see a steady increase in the amount of vaccine available. As that happens, we are hoping to see that continued strong interest in getting vaccinated. Vaccine is our best protection against the flu, and as supply increases, we need to be ready on the part of healthcare workers, on the part of the public health departments throughout the country, and on the part of people who want to get vaccinated to find the vaccine and get it. I want to say a few words about seasonal flu vaccine. More than 85 million doses have been distributed, and just to remind you, seasonal flu vaccine is distributed by the manufacturers. It does not go through the public system. We provide about 10% of the overall seasonal vaccine, so we don't have as much awareness of where it is and where the shortages are. We heard a number of reports of shortages in seasonal flu vaccine availability. These were surprising to us until we got back earlier this week new data about the uptake of seasonal flu vaccination, which has been unprecedented. By our estimates, over 60 million people have already been vaccinated for seasonal influenza. That is way more, way sooner than in any prior year. And that's strong uptake, and we hope that that trend continues.